there's an old saying that says home is for health, but hospital is for repairs. And actually what happens widely in our life in terms of where we live, we've got good housing, is our family okay, have we got a job, have we got good social connections? All of those things really play into our health and well-being, and without them, then actually often some of the symptoms of physical ill health can start to manifest.
So as community link workers, we're employed by Edberts House, but we actually sit as part of the GP practice team. I think that's really important because it enables patients to trust us, patients know that we're part of the practice team. It allows us to build good relationships with the clinical staff, but also the admin staff, so that we can all be working together really well.
I was referred to Deb from my doctor because of my depression, and I needed help with my dual being stopped, and help with trying to get a council flat.
I got in touch with the community link workers through the doctor's receptionist. I was having problems with my son's benefits, and the community link worker came to the house. She made us feel really comfortable. I explained my story to her, and she headed us in the right direction.
I'm able to read the patient's history, to find out what's going on with them, and then after I see a patient, I'm able to use our assessment and to give a full and complete assessment of the patient, so that obviously everybody that's in the practice is able to read that.
I was very depressed and isolated, and I found it hard to make friends or find somewhere for myself to go. And that's why I was referred from the doctors to Moira to help find somewhere for me to go to.
My self-harming is taking extra pills, not to end my life, but instead of cutting myself, I take pills. And not having the support before, all I had was the crisis team. And I just felt like dumped by the system, that I wasn't bad enough.
Nationally, the figures around patients attending consultations for non-medically related problems is 1 in 5 patients. At just one of our practices, this would amount to 157 patients per week, 52 hours per week, and a cost of £12,246 per week. In the East locality across our 4 practices, in the last 12 months we've actually referred 714 of these patients to see our community link workers.
When they referred me to the link worker, I didn't actually know what a link worker was or what it involved. If there was a time span, you could only see them for so long. So I was apprehensive, but once I'd made the initial introduction, then I found that I clicked with the person, so it's made the transition a lot easier.
If it wasn't for the community work, when my head is, my brain is, I honestly don't know where I'd be now. I had a bad Christmas, blood clot in my lung, pure as deed, nerves was down in my feet. With the depression, I think I would have been, I don't know if I would have lasted.
With the depth of knowledge and experience that Debs and Moira have as the community link workers, this has had a positive impact on the community and for those patients, leading to less appointments being needed, which of course is a benefit to practices and patients.
The community linking project's definitely changed our approach to patient care. We now have a much more holistic approach to patient care, much more complete.
Without the help of the community link work, I don't think I would have done it. They're ideal to talk to, they listen to you, get in touch with them so easily, and I would recommend it to anybody.
Medicines are not the whole answer to patients' problems. There's a lot of social deprivation in the Felling area, so there are lots of practical things that the Community Linking Project can address, which medicines don't always have a role to play.
Pulling together and working effectively in trusted partnerships, we can start to really see people's whole picture. Not just their housing over here and their education over here, but actually bringing those things together, and that in that way we're really able to help the whole person. And in the end, I believe that approach will be what tackles some of the greatest health inequalities in our country.